Oftentimes, after parents find out that their child has craniosynostosis, they are told that surgery would be purely cosmetic. But is it really? In this video, I will be discussing a few of the effects that craniosynostosis can have on the children and a few of the ways to treat craniosynostosis. Hey there, Salina here, and this is my next video, my series for Craniosynostosis Awareness Month. And as you can see, I have on my purple shirt. So the first thing I'm going to be talking about effects that craniosynostosis can possibly have on the child, and these are things that vary from child to child or person to person. I would like to say that I am not a doctor and I am not an expert on this subject. All of this is information that I have found via my own research. So it is important to do your own and consult with your doctors. And also a great place to go for any extra information is a Facebook group called Kids Craniosynostosis Support, which I will be talking about, which I will be talking about a little bit in this video. So how does it affect the child? A study done by Yale looked at non-syndromatic single suture sagittal craniosynostosis kids from ages 6 to 16, and they found that these kids were often within the normal intelligence range, but 50% of the kids had reading and or spelling learning disabilities. So pretty much what this is saying is that kids with craniosynostosis, single suture sagittal non-syndromatic craniosynostosis, to be specific if you would like, have a higher risk of having a reading and or spelling learning disability, even though they may fall within the normal intelligence range. Another study found that single suture craniosynostosis kids often have trouble with attention and planning, processing speeds, visual spatial skills, language, spelling, and reading. So the language and spelling and reading are ones that kind of continue to come up in studies. There are also potential problems with increased pressure on the brain, which also causes a range of other problems. And this is not something that happens all the time, but it is more likely to happen with multiple suture craniosynostosis. There are also issues with potential vision problems, developmental delays, and behavior problems. And again, this is something that is going to vary from person to person and child to child. So some may have these issues and some may not. So now I'm going to discuss some of the different ways to treat the disorder. And in this part, it is very important to do what is best for your family, what you feel is best, and following your intuition. No one can decide for you what is going to be best for your child. Some people have gone one way and say that that way is what was best for them, and another family would say, no, we would never do that. We chose this. So you have to do what is best for your family, and also consult with your doctor. If you are wanting to get a second opinion, you can go to capskids.org, and that is a great place to potentially find a doctor to get a second opinion for your child. If you want to talk to other parents who have made certain decisions, you can go to Cranio Kids Craniosynostosis Support, which is a group on Facebook, and it is full of adults who have had craniosynostosis and parents of kids who have had craniosynostosis. So that is also a great resource. So there are 4 types of treatment available for craniosynostosis, and the first one is no treatment at all. This option is mostly given to parents of kids with metopic craniosynostosis, though there are other cases of people with other types that have gotten this option and have done this option. Kids who don't have a mild version of these conditions, there is the possibility of your child having complications if you don't get the surgery, and then there is the possibility of nothing being wrong with them if you go with no treatment. I think I already said that it depends upon the severity of the condition that your child has. So there are adults who are fine and functioning. There are others who do complain of constant headaches. And with metopic, the pointiness does often go away. That is the first option, which is no treatment. The second one is just a helmet, which is very rare to happen. This is purely cosmetic if you go with the just helmet route. And it also depends upon the severity of the condition because the helmet may not even work considering the fact that one of the sutures are closed. So now I'm going to talk about the two different types of surgery for this condition. I'm going to try to be as unbiased as possible, though I am partial to endoscopic surgery because that is the one that we chose for our son. But again, I'm going to try to be as unbiased as possible. If you want the opinion of a parent who has chosen open or CVR surgery, again, I would go to that Facebook group, which will be linked down below. Both surgeries do have the potential of the child having to have a second surgery later on in life, or some kids do end up having more than two, but that is something that is rare. Now they have zigzag incisions, or a kind of wavy incision that helps when the hair grows back. The hair around the incision will fall more naturally and cover up the incision. Endoscopic surgery is minimally invasive, and the open or CVR surgery is more invasive. So first, I'm going to be talking about the endoscopic surgery. The endoscopic surgery is a surgery where they go in through either one or two incisions at the top of the head, and they take out a piece of the skull, or they break up the top part of the skull, and it's just at the top. This surgery also requires helmet therapy after to help correct the shape of the head. This surgery is usually done between 3 and 6 months because of the requirement of the helmet afterwards. It has to be done earlier. There are two options for this surgery, and one, which currently as I'm making this video, is only available at, I believe, Johns Hopkins, and they only do one incision at the top of the head, and they go in and they do everything they need through there. And the second option, which is available in more places, has two incisions, so one small one at the top and a longer one at the back of the skull. With this surgery, they only cut the child's hair around where the incisions are going to be, so you don't have to worry about your child losing all of their hair. This surgery is about 2 hours, give or take. The hospital stay will be between 3 and 7 days. One of the main cons with the surgery is all of the appointments with the helmet after and having to clean the helmet, which for me wasn't a huge deal. There is a low risk of the child needing a blood infusion with the surgery. It is a possibility, but it's a very low risk, and there is the possible risk of the child actually getting a CVR. So if they open up and they find that they can't do what they need to do with the endoscopic procedure, they will go on ahead and do a CVR. So the next surgery that I'm going to be talking about is the open surgery, or CVR. And if you did not know, CVR stands for cranial vault reconstruction. This surgery, they go in through one long incision, which usually goes from ear to ear, all the way around the head, so it's a pretty big incision. With this surgery, they go in and they break up the skull and they reshape the head that way, so the head already has a desired shape, and they put the pieces are held together by dissolvable plates and screws within the head. This surgery is usually done 6 months and older, though sometimes it may be done a little earlier. One of the main pros with the surgery is that afterwards there aren't really too many more appointments. Of course, they want to follow up and see how the child is doing, but like with the endoscopic surgery, you will have appointments every 2 to 3 weeks to check up on the helmet and how their child is doing in the helmet, and these appointments will be with an orthopedic doctor, so it may not be at the children's hospital where your child got the surgery done. It can be somewhere else. With the surgery, there is a higher risk of infusion, of the child needing a blood infusion. This surgery is around 4 hours, give or take. With this surgery, they do shave off the vast majority of the child's hair. Like, there may be like a little bit left, but most of it's gone. This surgery has been around the longest, and that's a big thing because surgeons are more likely to have more practice in this surgery than what they are with the endoscopic surgery. The hospital stay is usually around 7 months plus, give or take. Personally, for me, we chose the endoscopic. I like the idea of having a helmet because it protects my son's head, whereas with the open surgery, they just went in and broke up the skull, and now it's got to heal and there's no kind of protection for the child's head, and that really scared me. So that's one of the main reasons why we decided to go with the endoscopic surgery. But it is very important to decide what is going to be best for you and your family. The doctors won't really be able to give you too many options, I guess, on like which one is going to be best for your family if you have the option of doing the endoscopic. If your child is found later on to have craniosynostosis, then endoscopic might not even be an option. But if it is, the doctors can't really tell you which one is going to be better because each family is different, and for some families having a helmet may not work for them, and for others like my family it may be what is better. So the next part I'm actually going to be reading off of the computer, and this part goes over distractors, which is something that I just recently found out about. To me, distractors are kind of scary, but for some kids it is necessary. Okay, so I'm going to be looking down at this part because I am reading off of the computer, and I will link this website below. Posterior cranial vault distractor osteogenesis is a new technique that has emerged as a powerful procedure in treating patients with syndromatic bicornal craniosynostosis. It is performed at major craniofacial centers in children's hospitals throughout the world to treat syndromatic craniosynostosis. These patients have such severe gross disturbance of the skull that they often require 2 or more cranial vault expansions to prevent or relieve increased intracranial pressure or normalize appearance. So this is usually done with kids who have pressure on their brain. Distractor osteogenesis is a technique where cuts are made in the bones and specialized devices are placed. Healing is allowed to begin, and often the distractors are turned or activated to move the cut ends of the bone away from one another slowly over time. This creates a new bone gap and allows for generation of new bone and repositioning of the bone also. This procedure has been around for 25 years. So yeah, distractors are usually used for syndromatic kids and with that have pressure on the brain. So that is it for all of the information that I have. If there's any information that I have left out that you feel should be added to this video, please let me know and I will put it down in the description. And if you would like to talk to any parents who, whether the decision was not to get surgery or they chose endoscopic or they chose open surgery, then please go to the group Cranio Kids Craniosynostosis Support. It is a wonderful group to find information, and again, you need to choose what is going to be best for you and your family. If you need a second opinion, go to capskids.org. I hope this video is helpful to somebody, and again, if I leave any information out that you feel should be added to this video, please comment below and I will add it to the description. So that's it for this video. Thank you guys so much for watching. New video every Sunday and every Wednesday. If you have any requests, please let me know. I would love to do them, and until next time, deuces.